A new survey has found it's too early to end grants implemented under lockdown. There's been a drastic increase in both adult and child hunger in recent months, but this has been somewhat cushioned by relief schemes. Newzroom Afrika's Ramafsi filed this report.
Despite the easing of lockdown regulations, there's still a significant number of people who are going to bed hungry. According to the National Income Dynamic Studies Coronavirus Rapid Mobile Survey, food security improvements since the year 2000 as a result of the child support grant have been almost entirely undone by lockdown. Between May and June, under lockdown levels 4 and 3, at least one person in 22% of households went to bed hungry, while 15% of homes reported child hunger. Nearly half of the surveyed households reported running out of money to buy food. But the numbers for July and August improved. Adult and child hunger went down to 16 and 11% respectively, while the number of households running out of food went down from 47 to 37%. Black South Africans continue to bear most of the brunt. The improvements in food security are largely as a result of the temporary relief grant measures put in place by the government. The survey warns it will be disastrous to end the temporary relief grants, which the government said it would stop at the end of this month. For Newzroom Afrika on Channel 405, I am Ramashi.
For more on the National Income Dynamic Studies Coronavirus Rapid Mobile Survey, the University of the Free State's Professor Ivan Turrok joins us now to talk about this. Professor, thank you so much for your time tonight. Let's just begin with, the social grants, particularly when you look at how, as you say, it will be, if removed prematurely, it will really exacerbate the hunger problems that South Africa faces. But how does then South Africa begin to continue with these particular grants, especially looking at the fact that it's not even able to meet some of its own needs, and some of those that have been waiting for the 350 Rand unemployment grant are still waiting?
Well, it's about priorities, isn't it? The government has to prioritize what it spends its money on, and it seems to the team that social grants are really, at this time of crisis, a top priority. We don't want, it's not acceptable for people to be going hungry. This is damaging to their development. It causes malnutrition, it causes stunting, and it has causes people to be very angry and so on. So we need to extend these grants. 6 months is not long enough. The recovery is still too soon to withdraw them. You can see the labor market is not recovered. So the immediate priority, I think, is to maintain these grants. They're not very generous, there's not a lot of money, but it's the least government can do.
And when you look at, the COVID-19 pandemic, it certainly has cast the spotlight on the battle of the haves and the have-nots, and really reminding South Africans just how unequal a society we are.
That's right. It's exposed these very marked differences, these cleavages in society between the rich and the poor, black and white, men and women, urban and rural, shack dwellers and suburban residents. Well-skilled and low-skilled, well-educated. So it's been a traumatic experience the last 6 months, there's no doubt.
And when you talk about, the housing crisis in particular, you look at the fact that there were some concerns around infections, particularly around, heavily dense, in fact, densely populated areas where government was really battling to contain the infection. But the housing crisis is not a new one to South Africa. How does government, begin to really sort this out?
That's a very important question. So the population density that people were concerned about, it needs to be converted. The dense settlements need to be converted into an idea of economic density. So it's not just mere population density, but we get investment into these places to create better homes, to give people more living space so they can practice social distancing, to build multi-story, 2-, 3-story properties, to free up space at ground floor level, to improve the infrastructure of these settlements so that people have proper access to water, clean water and sanitation. The public health crisis has been really exposed by the pandemic, and we need to use the crisis to create a longer-term solution so that people are living in decent and dignified conditions with good public services and decent housing.
And do you think that, government's response when it comes to dealing with different communities, as you say, because if it's the battle of the haves and the have-nots, you certainly cannot deal with it in the same way?
No, you can't. And I think this has been a concern, that we've had this uniform, blunt national response. We've covered the whole country like a blanket with the same kinds of policies and measures. And that was fine for the initial lockdown, but now it's no longer appropriate because we see some communities suffering much more than others. So we need to target policies into those places which have the biggest challenges, where hunger is highest, which are most dependent on grants, where unemployment is highest. We need to target these communities with jobs, with skills, with investment in better living conditions. I think that's a key message.
And when you look at, of course, the shacks in and of themselves, as you talk about sustainable solutions that can really take the country into its future, the survey is also suggesting that we need, as South Africa, to do away with shacks?
In the long term, we do. It's not dignified, it's unhealthy, it's dangerous, it creates vulnerabilities if you live in a shack. They're cold in winter, they leak when it rains. So we need to work towards, of course, we're not going to solve this problem overnight. In some of our cities, 1 in 5 households lives in a shack. So we need to have a long-term solution, but we need to start quite soon addressing this with a phased program of improvement, working with people themselves, not just building them and giving them a free house. We can't afford that. We need to work with communities, develop their skills so that jointly government and communities create better settlements with decent housing. There's no reason we shouldn't be doing that and mobilize the whole community around this effort to build back better. I think that's a key message.
And it sounds like you're saying that then the approach doesn't need to be top-down, it needs to be bottom-up.
We do things too often in a top-down way. So we issue a contract, a tender for water tanks, for temporary accommodation, or for portable toilets. We need to be saying, let's get our hands dirty, let's work with communities, we'll create jobs that way, we'll build skills and we'll develop entrepreneurship in these ways by working with communities in a bottom-up way. We'll respond better to community concerns, we'll rebuild the trust between ordinary people and government, which has broken down in recent months, and we will transform our situation by working together in partnership at the local level. That's a key message.
And often when we hear messages from some of our leaders in government, it does look like they're somewhat operating in silos and especially not communicating with each other. When it comes to this particular pandemic, how critical is it going to be, and particularly going forward, to ensure that various departments do some information sharing and are also working together?
This is absolutely critical. We want our municipalities, our provinces, our national departments to work together, because none of them have the solution or the resources in themselves to deal with this challenge. It's a multi-dimensional challenge. It's not just housing, it's not just water, it's not just a health crisis. It's a multi-dimensional crisis, so it requires a joined-up response from all parts of government. So we need to break away from the silos, and we need to encourage real collaboration and coordination. We need to create task teams within particular communities where the key agencies come together, work with the community, sit down together, decide what the priorities are, and decide where within the community they're going to target the initial investment and work together on a plan for redevelopment, upgrading and improvement of our communities.
And certainly, as a final question from me tonight, from what you're saying, I mean, prioritizing is really something critical here, especially when we keep seeing reports of corruption emerge and how money is, looted and not finding its way into the very communities that need it the most.
That's the benefit of a partnership, especially one involving the community, right? You get transparency, you get accountability. Everybody, the key players around the table, they talk to each other, they explain what they're doing, they account for their spending, they discuss priorities, and they monitor performance over time. 6 months down the line, how much have we done? Do we need to speed up? Do we need to do things differently? That's the benefit of partnership working. We need to take the president at his word and build these compacts at the local level where they really matter. And that way we can move forward together, restore confidence, rebuild trust, and really address our problems in a very concerted way.
All right. Thank you so much for your time tonight. That's Professor Ivan Turrok. He is with the University of the Free State, touching on a very important subject there and how, COVID-19 has really had a devastating impact on some townships and